did a lot of work last night, largely as a consequence of my discussions with Senator Loftus, Senator from Greenville, Senator Campson, Senator from Charleston, Senator Kimbrell, Senator from Spartanburg, and others, in regard to how can we bring the expertise, skill, and experience of our pharmacists into that dispensing process. I had a conversation with the head of the pharmacology or the pharmacy division in Louisiana that supervises the medical marijuana program there. Staff is working on a comprehensive amendment that would interpose pharmacists and their skill sets at that frontline level with patients. And I hope to have that amendment. I will have that amendment ready by next week so we can discuss it in detail. But that's an excellent example of what I was saying yesterday, and in all sincerity, that I've worked on this bill for 7 years, but there are going to be things that haven't occurred to me or things that I haven't considered or ideas that members of this body have in that regard. And when my friends get a chance to take the well in regard to why they think this bill isn't the best interest of South Carolina and as to why, I'll be listening to them closely so that I can make a good faith effort to address their concerns. Because I realize that for a lot of the members, this is the first time that they're really engaging on this. I mean, it's a 59-page bill. Only 17 senators serve on medical affairs. It's a 45-member body now. Everybody's is busy with other bills that are moving through other committees. And so I'm mindful of the fact that there are people that could weigh in on this to help improve it. And I pledge to you that I will listen to that and do my best to incorporate those thoughts. With that by way of background, I'll go through the bill in fair detail, and I think it'll probably take me about 20 to 30 minutes to kind of walk through the sections and give you an idea of what's in here. And then it's my understanding that there are some individuals who have questions about the various sections, and I'll be happy to answer those questions to the best of my ability. The first part of the bill, the preamble, is just simply whereas clauses, certain findings of fact in regard to why this Compassionate Care Act should be enacted. And it starts out by reciting that as of January 31, 36 states and the District of Columbia have authorized cannabis for medicinal use. Of course, that should be 37 states now, with Mississippi having passed yesterday. The second finding of fact is in regard to some of the things I talked about yesterday that Congress has done to defer to the states in this regard. I noted that in the Controlled Substances Act, there was no declaration in there that Congress intended to preempt the field. In fact, to the contrary, there was a statement in the CSA that expressly stated that it did not intend to preempt the field and that it would recognize state action taken in the area of controlled substances. I also walked through how the Department of the Treasury issued guidances to banks and credit unions that want to deposit proceeds from medical cannabis establishments. I talked about how the IRS has promulgated regulations in regard to how cannabis operators should prepare their taxes. I mean, what is particular about the cannabis industry that they need to be aware of in order to be in the IRS's good graces. I talked about the guidance that the Department of Justice has issued in regard to mergers and acquisitions for the cannabis industry. And it's really, my point there was, there is just a general recognition at the federal government level in multiple instances that this is a reality now. States have done this. States have acted legally to do this. Courts have upheld the state's right to do this. And the federal agencies are responding in kind by issuing regs to provide guidance to those industries as they interact with the federal government. And then finally, of course, you have the annual budget appropriation rider that prohibits the Department of Justice from using any of its appropriated funds to challenge any state that has medical cannabis law. So I think in multiple respects, the federal government has given the states a green light to determine what's in their state's best interests. Again, the debate here is what is in their best interest. But I don't want there to be any lingering concern in regard to do we have the authority to act. Now, I admit it's a separate question, should we act? And that's what we're talking about. But at least as an initial threshold matter, there's not a federal prohibition in that regard. Moving on from, in the preamble, I simply talk about the various institutions that have endorsed the use of medical cannabis: the American Academy of HIV Medicine, the American College of Physicians, the American Nurses Association, the American Public Health Association, Leukemia and Lymphoma Society, and the Multiple Sclerosis Society, Epilepsy Foundation, Pain Foundation. I mean, I recite that because it's important to understand that even though you're talking about cannabis and something that is a federal Schedule I drug, 37 states now have legalized it, and these medical associations have endorsed it based upon a body of scientific evidence that has been developed over time since we've had medical cannabis laws in place in various states for at least 2 decades. We then move on to the first section of the Act in talking about allowable amounts of cannabis. And here it's a bit different than what you see in a lot of other states when they talk about the allowable amount of cannabis, because other states allow leaf, they allow flower. And so they talk about, Mississippi just passed a law, I think it talks about 3.5 ounces is what the Senate had. The House had 3.0 ounces monthly of cannabis. I don't know where that ended up in the reconciliation process, but that's an example of how allowable amounts is described in most other states that allow burning of leaf. But because of the concession that we made to SLED, and I was glad to do so because I respect SLED, we don't have burning of leaf. And so what we have instead are oils. And I borrowed, or the bill borrows from what Ohio did, because Ohio also did this. They translated what an amount of cannabis leaf would be into milligrams of oil, what they would be. And so it's broken down in that regard. It talks about cannabis products for topical administration. And again, I'm in section 44-53-210 under the definition of allowable amount of medical cannabis. Then the first subparagraph is cannabis products for topical administration, including but not limited to patches for transdermal administration or lotions, creams, or ointments, contain no more than 4,000 milligrams of delta THC. Cannabis products for oral administration, including not limited to oils, tinctures, capsules, edible forms, contain no more than 1,600 milligrams of THC. Cannabis products that consist of oils for vaporization that contain a total of no more than 8,200 milligrams of delta THC. And each of those allowable amounts is for a 14-day period.